So I'm going to actually introduce myself as well. My name's Joy Redstone, and I'm a social worker and an addiction counselor. I run Naropa Community Counseling, which is a agency that provides sliding scale therapy and Medicaid therapy to folks that can't otherwise afford therapy. One of the reasons I feel really passionately about this topic is that have many folks in my family that suffer from mood disorders, and I've also had lost a family member to suicide. So I feel really personally and profoundly about getting this message out, and that we need to talk about this as a community. I'll ask Faye to go over some of our goals today.
Oh, yeah. So we have 5 goals. One is to shine a light and offer some safe exposure and engagement with topics of depression, self-harm, and suicide. So one of the big issues is we don't talk enough about this. So our goal is to destigmatize just talking about this, and to create a venue where we're talking and it's just like normal conversation. To help families understand and relate to loved ones struggling with these issues with compassion, respect, and care. And
we'd like to also support community members who are going through this right now. Maybe yourself or someone else is struggling with depression, self-harm, or suicide. And particularly if you have a kid that's going through this, it's really, really hard and confusing to know what to do as a parent.
It's a wasteland out there.
Yeah. And we want to know when to be worried and when to act and when not to. And today we're also going to go over some of the things that you do when someone's struggling in this area. So, hey, depression. Let's talk about depression.
Okay. Yeah. So on our little slide, I wanted to sort of just, people sometimes don't know the difference between, I'm finding in my practice, depression and grief. Those seem to always, so we define depression as, in our conversation, is a common and serious medical condition that negatively affects how you feel, the way you think, and how you act. You want to take it?
Sure. Sometimes parents worry because their teenager or a family worries because someone seems sad. There's a difference between depression and a sad mood. Depression includes sadness, but oftentimes people are having real trouble with sleep and appetite and feeling hopeless and lonely. One of the things that's really valuable about having this discussion is that depression is really, really common. 1 in 15 adults experience clinical depression in any given year. That's 6.7% of the entire population. And 1 in 6 people will have depression at some point in their life. A lot of times it does show up in the late teens or early 20s, but it can happen really at any point of life. And you wanted to say something about the difference between depression and grief. I think that's important.
So I've just been noticing a lot of people that are experiencing loss, they come and they define it as depression. There is a normal sadness that we need to remember and not pathologize. That and also in piggybacking with Joy, we have had in Second Wind Fund an enormous growth in young children receiving our services. We have started seeing that depression is moving down. We have a 7-year-old who's depressed that's receiving our services that's at risk for suicide. So there isn't even a floor on this topic anymore. And I want to definitely make sure that you know that.
Symptoms of depression in detail look often like the person feeling sad on the inside, even if things in their life are going okay on the outside. And that's why it can fly under our radar a lot. But things that you might notice in someone that's experiencing depression, particularly, are sleeping a lot or sleeping very, very little, feeling exhausted, um, having trouble eating. They might say things like, food tastes like cardboard. I know I'm supposed to eat, but it just doesn't feel important. Um, a lot of times people have a hard time motivating themselves to do things, or they feel so worthless. You hear people say things like, well, I think it would, they're not necessarily expressing suicide, but they're saying things like, maybe we all would be better off if I weren't here. Um, it can be really hard to concentrate, even for someone that's really smart and definitely usually performs well at school and work. You can see people's focus and concentration really start to suffer, and making decisions is hard. And a person might frequently just be thinking a lot about death. What does death mean? What happens after you die? A lot of times you hear people say things like, um, hear people say things like, I don't want to have a plan to hurt myself, but maybe it would be easier if I just weren't here. I'm just so tired of hurting all the time. That's frequently what the dialogue sounds like. I see we have a question.
Yeah, this is a really good question. Why is violence decreasing while suicide rates are increasing? Well, the way I learned about depression and suicide was depression is anger turned towards the self, which I find to be very comforting. So we have a lot of violence happening in our society, but not of good venue for people to express their feelings. So a lot of need for emotional intelligence and education about feelings. And sometimes as a parent, just doing that can be very helpful. I'm not sure violence is decreasing, frankly. So that's probably why I'm struggling with. What do you think, Joy? Do you think violence is decreasing?
I'm not sure about that, and that's sort of a
Yeah.
sociological question,
Right,
but
right.
I'm wondering.
I actually know that mass casualties, right, are increasing,
Yes.
but violence overall, the
Okay.
statistics are decreasing, which is an interesting
Okay, so
additional puzzle piece, right?
that's interesting, Dan, because mass casualties could be another way of saying suicide by cop.
Right.
So, which is really big in the field of suicidology right now. Without getting too high up into the weeds here. Anything else, Joy or Kim?
I don't understand.
Okay.
Well,
So she didn't.
cop, suicide by cop.
I'm really in a situation.
Yeah. Anything more?
No, I don't think so.
Okay. And suicidal males.
It's probably really the numbers of suicide in many categories.
Yes.
And there's a lot of thinking about why that might be, such as people are sometimes the people that move here are more cut off from their families, or they're people that are willing to take kind of greater risks in life. There's a lot of unseen poverty in Colorado. And a fascinating National Geographic article about the rate of suicide in Colorado, particularly in the ski towns. And they were talking about this phenomenon where you compare your life, which might be a hard life, where you're working really hard on the lift operator, or maybe you're working in a restaurant, and you're comparing that to people on vacation, and you feel this inner disparity between what you're experiencing and what your life is like, and what this very privileged life looks like that you're just getting a little snapshot of. Um, Annie, I wanted to go back to the idea of talking about when to get help for depression. So do you have a rule of thumb about when to get help for depression?
Yeah, so I think the best rule of thumb is to go if you find yourself in a very deep, dark place for at least 2 weeks. That probably means that something's going on, that you should talk with somebody. Now, it might be talking with a friend, talking with a person in your community, and then starting to reach out. Sometimes it's just we isolate ourselves when we're depressed. So sometimes even just putting words to those feelings can be very helpful.
You know, I want to add another good rule of thumb is to think about how much it's affecting your functioning. I mean, we get sad sometimes. Sad things happen, and it's normal to have sad emotions. But if it's making it hard to show up at work or with your family or socially, that's a good measuring stick for yourself that perhaps it's becoming more serious and it's time to get help. But I really want to emphasize, if you are actually at the point of suicide or planning it specifically, you do a mental health professional ASAP. Depression is very, very treatable. There's a lot of cultural, myths and misunderstandings about mental illness in our society, but there is incredible amount of data that says that the best treatment for depression is the combination of talk therapy and sometimes medication with that. And that's what helps people get better. How is depression treated? Medication, as I mentioned. There's many different models and forms of talk therapy. There are different, more cutting edge therapies like transcranial magnetic stimulation. There are cutting edge therapies with the use of psychedelics like MDMA and ketamine. But for many people, if you can get enough sleep, exercise, eat healthy, make some social connections, and stay away from too much alcohol, that can help depression. You see that there's a question.
I'll read this question out for you folks. My teen has been depressed for a couple of years now refusing to try meds. The father thinks she's fine and refuses to allow, this is very common, right? In divorce situations especially, and counseling, right? So the father doesn't want that. And exercise and healthy eating habits, and pretty much isolate. So she's not doing that stuff. She's not doing the self-care stuff. She says, I can't make her do anything and she can help herself. What are my options to help her?
Question.
I have an idea. I know that Mental Health Partners specifically has a team that will do therapy in the home for at-risk adolescents. And it's a tough situation, right? Because you cannot put a teenager in the car and force them to go to therapy. But sometimes bringing the therapist, it's an old model. In the old days, therapists really did do house calls, but Mental Health Partners has that, and that can reach people reach teens in a different way. And I see another question about, is there
that's what it's called.
Oh, I'm sorry. Dan is reminding me that that's called functional family therapy. And you do have to go through a screening process with Mental Health Partners to make sure that it's a situation that they can help with. I also see another question. Is there a better type of psychotherapy for teenagers than another? And I know Faye has some thoughts, but I'm going to say,
well, what I find,
just let me
I'm sorry.
Get that one out. We're also excited to talk about this.
Yes, and we talk over each other sometimes.
I was going to mention that things that are experiential, things where you can get kids outside, where they can be connected to animals, dogs or horses. Many that work with teenagers are willing to do therapy in unconventional ways in order to connect with them. But this is Faye's like expertise. So I'm going to shut up now.
Well, you're an expert too, Carol. I think what Joy had to say was so important. We cannot do therapy with kids the same way we do it with adults. So some of the people that I have working for me do equine therapy, which is that wind horse?
You're thinking medicine horse.
Medicine horse. So one of our folks, which I think is wonderful because I have 2 therapy dogs. So it's always a great icebreaker for kids. We play out in the yard, even our teens, and make it so that it's not like a heavy duty, because they're already feeling heavy. So I like to lighten things when I work with teenagers. We might play music. Sometimes I have kids that actually bring music that they just listen to and they analyze it for me. I even do a little art therapy with kids because there is an important create a relationship. I think the best type of therapy is really, it's more of an issue of the fit with a therapist and the kid.
Yeah. And as I was listening to you talk, I was thinking about how those are the things that we use to connect with our kids as parents.
Exactly.
We try to listen to their music. We try to do art with them. We try to show interest in the things that they're interested in. I know as a parent of a teenager, though, that even when I try those things, I tend to get annoyed by their behavior or what they have or haven't done. A therapist that can give a neutral response to some of the feelings and behaviors that a teenager is demonstrating sometimes can gain a little bit more traction than a parent.
Yes.
Even if we're wonderful parents.
So there's another good question here, Joy and Kim.
Yes, I missed that.
Are symptoms of depression in teens different for boys and girls?
I've read some information about depression looking different in men and women in general. I'm not an expert on the teens.
I just know a couple of statistics that I've recently read. The first is that in the last 7 years, middle school girls, so from 2011 until 2018, middle school girls have tripled the rate of self-harm, either through cutting or an effort through pills, and ended up in the emergency room. So emergency room visits have tripled for middle school girls. Emergency room visits for middle school boys haven't tripled. However, both rates have also shot up in terms of the increase in suicides for boys and girls. So, and boys also tend to be more successful when they try.
Yeah, that's really good. That's good.
And
yeah,
I think what I wanted to say about male and female presentations of depression is to reach back to what you were talking about earlier, Faye, the anger turns inwards.
Yes.
A lot of times with girls and women, it does present more like the sadness and crying and hopeless and guilt. And with boys and men, it can look more like the irritable, isolated
anger
kind of
criminality is a big factor too. With teenage boys. Sometimes they'll come to us because they've been arrested. So that's a really important part too. Okay,
I see another question.
Do you want me to? I'll just read it out for everybody. It says, "I have a friend who is going through a divorce right now and does not have a therapist. I'm concerned he's suicidal, but he is afraid of being put in the hospital again, and he will not reach out for help. Understandable, because the hospital is a very, very unfun experience, although it is totally necessary sometimes. Is the suicide hotline the best way to get immediate professional help? He is currently taking Prozac after a bad response to Effexor."
One of the things that the suicide hotline can do is provide advice to a friend or family member. And so you can make that call, talk about what you see in the friend's behavior, and they can tell you how they see it and advise you on the best ways to help. But the good news is there are a lot of options for people now that go through the crisis service that don't involve going to the hospital. And in fact, their goal is to help people avoid going to the hospital. So there are what's called crisis stabilization units that are not locked, where a person can go some respite for a few days. They can leave whenever they want to. I understand why people get scared and worried about going to the hospital, but there's all kinds of creative ideas and options out there that are less life altering than going to the hospital. Did you have something, Faye?
Yeah, I was just, as I was reading this a second time, I thought of the person that sent the email. And I'm thinking, sometimes when we have friends we love and care about, and they tell us they're feeling hopeless and they might do something to themselves, we cannot hold that.
It's a lot.
That is a lot. So sometimes the best action we can take is just basically saying, should I worry about you? How can I be there for you? But sometimes when people go to the crisis center, hospitalized if it's really bad. So that is a part that people need to know. And sometimes that's not a bad thing, but that is definitely something that they might need to. Now, if they're taking Prozac, who's prescribing that? So does that doctor or that clinician know what's going on?
That's a good point, because that could be a way for your friend to get some support without having to feel so scared about calling the crisis team. And the psychiatrist will want to help.
Yeah,
for sure.
Or even the PCP.
The psychiatrist sure will. And psychiatrists are overwhelmed, and oftentimes there is a long wait. So if you're calling around for a psychiatrist, you might experience this sense that, oh my gosh, I can't find somebody. But if you go to the emergency room in a crisis, you will get a psychiatrist to evaluate that person in crisis before they leave the emergency room. That's guaranteed. So if you need a psychiatrist right away to look at someone and you're really, really worried, you just bring them into the emergency room.
Well, Dan, the thing that I've noticed too is most of my clients are getting prescribed medication from their primary care docs, because the terrain for psychiatrists is so little, and especially for children. There aren't a lot of child and adolescent psychiatrists.
The crisis center on Airport Road is a walk-in, and they also have some psychiatrist availability. Sometimes people can be helped by an intervention from a psychiatrist, and again, not need to go to the hospital.
So follow up on the PCP. So sometimes when I'm working with a client, especially a teenager, their friends will come in with them and they'll say, my friend isn't telling you the truth. I want you to know what's going on. And sometimes if you just say to your friend or family member, can I go with you to your next appointment? Yes. So that's important. Yeah. So.
What I also hear in this situation is that this is the classic situation that people face. Holding this information about a friend is so worrisome and hard. And I'm really appreciating that you care so much about your friend to try to get this information. And I think it would be amiss if I didn't say the crisis line number at this point, which is 303-447-1665. And they can help sort through the particularities of primary care,
Mhm.
psychiatrists, crisis service, etc. And we have someone sharing a resource with
Yeah,
us.
here we go.
It's the coloradocrisisservices.org website. It has all the locations and all the phone numbers statewide for the the walk-in crisis centers.
This is a wonderful thing. When I first started running Wind Fund, we didn't have this. So we as a state have done a wonderful job of making sure there are resources for folks all across the state related to this. So there are crisis centers all over the state. So, and I thank you for sharing that link. That was great. Okay.
I want to bring us to self-harming behaviors, because I know that that is super scary for people when they see a person self-harming. But in the field, we consider self-harming to be a different kind of category than suicide. We consider self-harm to be the act of hurting yourself through a physical injury, putting yourself in a dangerous situation, or self-neglect. What does this tend to look like in real life? Often it looks like cutting, hitting oneself, restricting food, binging in excess on drugs or food, engaging in unsafe behaviors, and essentially acting in ways that reinforce self-hatred. Classically, parents see their teenager cutting and they're terrified because they think it looks like suicide.
Yes.
But you work with teenagers directly.
Yeah.
How do you view it, Faye?
Well, when I get a parent who, I generally get a parent who comes in and they talk about they've discovered when summer happens, that they have cuts all up and down their thighs. I think I try to explain to them what the cutting is about first. Why do people cut? To relieve the pain. What is the pain about? So we start talking, so we have to start talking about what's going on. Why are they using that strategy to relieve pain? So what's that pain about? Where's it coming from? I even have some kids who burn themselves, which is really terrifying and horrifying, but they say it really helps.
Do you think of it as a way for someone to communicate their pain when they can't find the words?
That's a really good question, and I think there is a part of that, yes. But there's another part of it, they just want to relieve the pain. They don't care who sees it or doesn't see it, but it helps them. So I have a 18-year-old kid I worked with, and she would burn herself. And then I said, she was already on antidepressants, but we started talking and she went to her PCP and they gave her a medication on an as needed basis. She was so escalated with her anxiety that she could not self-regulate. And that's an important part of cutting. It's the inability to self-regulate your emotions.
I think people usually have a hard time understanding. I'm kind of a literal person, so
Okay.
I identify with this.
All right. Okay.
I think when it looks like it hurts, and you see that there is a cut or a burn on your kid's skin, it's hard to understand how that alleviates pain when it causes physical pain.
It's very weird, isn't it?
But I've been told that the act of doing it releases so many brain chemicals that the brain chemicals of like relaxation and comfort completely override the brain signals about pain.
Yeah.
But when you're looking at it,
right,
it's kind of scary.
It's horrifying. Oh, that's a really interesting. So now we have another question. Moving on to, did we finish all of our self-harming?
Well, let's speak to that, and then we can go back to self-harm.
Here. Can you speak to Xanax addiction? versus SSRIs
You're saying Xanax. The question is about using Xanax
as a
treat
self-medication,
to treat
probably.
things. Well, I'm wondering about that. To me,
So can we ask the person who?
So this, I believe this is about how anxiety for teenagers often gets prescribed SSRIs because they're afraid that teenagers are gonna get addicted to the Xanax because it has it has a shorter half-life or something.
So Xanax is a benzodiazepine, which does have a short half-life, which means you get immediate relief. It gets in your bloodstream fast. You feel better, and then leaves your bloodstream fast, and then you're kind of back to the same state. It is known to be highly addictive, and people struggle sometimes for years to successfully wean them off of Xanax or other benzodiazepines. So since that treatment has some risk, SSRIs do not give the bump up and bump down of the Xanax. So they change the brain chemistry slowly over time. So it's considered to be a less risky treatment alternative than Xanax. That's not to say people should never be prescribed this, that, or the other thing. We're not psychiatrists, but that's my understanding of the risk factors in that situation.
And for some people, that really is what they need. They need somewhere to just bring down their heart rate. They actually go into a panic attack. That's why a lot of times psychiatrists or doctors will prescribe the Xanax on an as-needed basis. And you're absolutely right. It leaves the bloodstream, but it is addictive.
Yeah.
Yeah.
And sometimes, you're making a good point. There's panic attacks that are very debilitating immediately, and you want an immediate treatment. It's different to have Xanax for a once in a while thing. And it's different than taking it 3 or 4 times a day for weeks or months or years at a time.
But we are getting so bombarded in the blogosphere with addictions, drug addictions. So we are getting to have to be more observant of that with our people. Okay, well, here's our next.
So I'm wondering if we can go back to the more explicit discussion about suicide.
Yes.
So people a lot. That was one of the most shocking things for me when I was working as a crisis clinician. I recognized that those were people who were already not feeling good. 6% of the population has serious thoughts of suicide every year. It's a lot of people being in internal pain and turmoil.
Okay. Let's see. Hang on a sec. Folks. 4 to 5% of all people attempt suicide in their lifetime, which is really quite remarkable if you think about that. More people die of suicide each year than in all the armed conflicts or from traffic accidents. Yeah, this is what keeps me up at night with what I do. So Colorado has the second highest suicide rate for kids. So
in the country?
In the country. Mm-hmm. So and we don't, like you said at the beginning, we don't know why that is. There could be access to guns. That's actually becoming a big issue.
Yeah.
There's the altitude has been talked about.
It has been linked to lower levels of serotonin in the brain.
Exactly. So those are important pieces.
I also heard that of the 10 leading preventable causes of death, medicine has figured out how to decrease the likelihood for 9 out of 10 of them, but suicide rates continue to increase.
That's interesting. Huh.
And I know that this is an area that is actually undercounted. We have 40,000 documented suicides in the country each year, but The way coroners report deaths is very, very affected by their concerns about societal shame and stigma that families experience. When I lost the person in my life to suicide, the coroner classified it as an accident because at that point we hadn't found the note. I'm virtually certain that that decision was to try to spare everyone from pain. The articles I've read suggest that the numbers of suicides may be undercounted, by a huge proportion. It could easily be like double the amount that is documented through the coroner's reports.
Yeah, the parents that I've worked with will actually ask the coroner not to put on the death certificate suicide.
Yeah.
Now, I have begun to notice that more recently there was a death in our community of a young woman at 21 who died by suicide. And her parents did the most beautiful obituary where they actually spoke about her mental illness. And that said she died by suicide, just to make sure that people understood that this is something we need to talk about. So
I have so much respect for that family's courage.
Yeah.
It is hard, particularly when you're in the moments of your own grief, to be so generous. And that's generous. That choice speaks to all the other kids and families in our community that are struggling with this issue and let them know that they're not alone. So I really,
it's very brave.
It is.
Yeah.
So what are some of the risk factors?
Yes. Okay. So we have on our little slide, prior attempt, recent psychiatric hospitalization, older age. That is actually the fastest growing suicide is older men. Now it's becoming older women. A mental disorder, feelings of hopelessness, as Joy talked about earlier, substance use, distorted thinking, and firearm ownership. So there's a whole list of more than this. We could probably have a list of 20 more factors.
Well, I was also thinking about loss.
Yes.
When people lose things that are important to them, like relationships, breakups, bereavement, lose jobs, get in trouble, almost anything like that can create a feeling of despair. I also, want to note that sometimes when someone is depressed for a long time and they go to the hospital and then get out, the family can think, oh, great, they got treatment at the hospital. But sometimes people get feeling just better enough to have the energy to follow through with those ideas. Or, being in the hospital can be really protective and helpful and comforting. And you're still faced with those real life problems. And people get overwhelmed.
Yeah.
Conference on World Affairs, and there was a panelist talking about suicide, and his name was Charlie. He was 66.
Right.
And Charlie was the most accomplished human being, the highest achieving academia person in the room by far. He was a Harvard professor. He had gotten a number of prestigious things and been directors of various different medical organizations, and was at the height of his career in his 60s. This is what he was describing on the panel, when he found that there was just such overwhelming, crippling anxiety. And even though he had been on meds earlier, he decided I was fine and got off them. And even though he started worrying about things like how he was going to jump off of the hospital where he worked, he kept it a secret for a long time. And then he realized, oh my gosh, if I don't do something, I'm just going to be so overwhelmed constantly.
I want to, can I take this
Yeah,
one?
yeah, please.
So we had a statement about a person having heard that suicide is an act of cowardice. This person expressed that they don't understand this line of thinking. So I think suicide is very hard to understand. And what I've heard it described is that it's like a tunnel closing in. It just starts feeling to people like there are no other rational choices. This is the answer. But those people who have lost someone they love to suicide, well, anger is part of the recovery from that. And I think that when people are calling suicide cowardly, they are speaking to the anger and loss that they feel, the sense of betrayal that this person that I love and was selfishly deprived me of their company. And almost any feeling that you have after someone commits suicide is normal. I mean, there's a range of feelings, and not all of them are our most pleasant feelings. I see that there's another comment. Do you want to take that one, Faye?
Oh, yeah. My teen found a picture of someone who had committed suicide, and the photo was made to look romantic and beautiful. What can a parent say to that? Well, I don't know if everybody's seen the show 13 Reasons Why. So a lot of parents are very upset about the sort of glorification of suicide and, sort of making it, it's not normalizing it, but sort of making it beautiful and romantic. So this is actually a very common feeling.
And more, I feel like kids who are angsty can find other kids who are angsty, who are wandering around the dark web posting memes like this on Reddit or 4chan, or doing self-harm and then writing poetry that is very deep in its exploration of self-harm, suicide, death, blood, and they find a little community online, which never used to happen before.
So in talking with this parent, I would actually just say to the kid, to your teen, what is it about this picture what do you see in this picture? Because I haven't heard that the child thinks that picture is romantic and beautiful. They might not actually experience a beautiful romantic picture as wonderful, actually. So if I am presented with a picture or something about, I would give the parent strategies for how to talk to your kid about that, because we see this every day in our offices. Oh, my kid watched the show and they thought it was just delightful, and then so I think it's very important as a parent to have a dialogue with your teen about what they're seeing, because you might be very surprised. They might think the same thing, that they don't think it's beautiful.
What's going to happen if we really freak out and are alarmed before we try to have that dialogue?
Right.
That's a good question. Another thing that I think about that's a little tricky here is sometimes teens don't always have a lot of ability to see into the future, like to think about what they might want in their, in their career, or what they want in their lives. It's why teens are considered to be risk takers and impulsive. And so when you see a romantic picture that seems like an easy solution, that can be really hard for people who aren't, whose brains aren't developed in the area of a lot of future planning. So it's like easy romantic solution versus hard work to get to my life goals, which I can't necessarily really picture very clearly anyway.
But the topic of suicide is so big and pervasive now. So I usually have somebody coming in talking about that.
Mm.
Either a teen, a parent, a grandparent even. So this is, I've heard that it's better not to say commit suicide. Do you agree with that? Yes.
Okay.
I say die by suicide.
Why?
Or because there's something about the word commit. There's like a lot of dialogue amongst the community.
Like
lot
it's
of
a
parents,
euphemism, or
yeah, I don't know what it is, but in working with parents and in working with the Community Hope Coalition, I've been educated that I shouldn't say commit.
okay.
So I've taken the experts who are my families and my colleagues who've had people that have died by suicide to say die by suicide. Now, I don't know what you say when it's not died by suicide. Any thoughts, Dan? It's a tough one.
Right?
Yeah.
Right?
Yeah.
It's well, and I feel like this is one of the difficulties, because if we can't even use a word, how do we actually really talk to
Yeah.
people who are thinking about this a lot and don't have anybody to talk to?
Exactly.
In suicide assessment and intervention, it is absolutely underlined to use very specific, direct words. To not say, are you thinking of hurting yourself?
Yeah.
To ask someone directly, looking in their eyes, are you thinking of dying? Are you thinking that you want to?
But aren't we afraid of doing that? Because if they weren't thinking of it, now we've introduced this.
There is
That's a
no,
big myth.
that is a huge myth. There's
Huge
no
myth.
evidence to support that you would ever plant the idea. That's people feel, there's a lot of common reactions to someone wanting to kill themselves, and it is very, very hard to talk about. And when it's someone in your circle that you really love, people tend to feel panicked, really afraid, maybe even frustrated or angry, like, or resentful, like, is this person just trying to yank my chain and manipulate me? Or helpless, like, oh my God, how am I ever going to help change things for this person so they don't feel this way? Hopeless, like, maybe the person really is in a bad situation. The person that was in my family that committed suicide was really, really sick and in a lot of pain for years, right? Like, that situation was homeless, hopeless. And it was very difficult to know what to do or say. And I think we have a societal conflict about this. Like, is it even right to intervene? Like, do we have the right to stop someone? People have deep ambivalences about that. And no one's ever expecting this situation to happen. And when it happens and you have all these confusing feelings in place, it makes it hard to know what to do or say in the moment. But I know for a fact that telling someone that you care about them and telling them that you want to help them and telling them that you don't want them to die, those are always safe and good things to say.
There's something else that this is reminding me of in terms of what was talked about at that conference on world affairs, because there was somebody who had studied thousands of suicides. He was an expert and had written like 500 articles. And he said that what they've discovered is that people, even if they're sort of depressed, down, anxious, that true wish to carry out a plan and have the means to carry out a plan, when they actually have the urge and want to do it, that typically that urge is never longer than 10 minutes.
Transient.
Transient, yeah.
That's very important. So the big, Kim, do you have any thoughts?
Thank you. I have had a really difficult time hearing everything that's being said, so I want to pop in, and I'm just trying to keep up with you guys, and
Okay.
you're doing a great job. So
Okay.
yes, and I'm afraid you might not even be hearing everything I'm saying. It seems my reception is not great, so I'm going to let you guys wrap things up. I'm so sorry for not being more available.
Kimberly, you're awesome. We can hear
Yeah,
you
we can
totally.
hear you fine.
just can't hear us because it's on a little choppy delay as easily. But just so you guys know, we're experimenting with getting Kimberly in through FaceTime and lots of technology because she is actually remotely calling in to try to make this as potent as possible.
Well, Kim, maybe could you help us with some ideas about how to ask these hard questions? I'm holding you up to the microphone, so I think everyone will hear you well. We are hearing you well.
Great, thank you. So in developing some of this PowerPoint, I really focused on how to ask the questions really succinctly. So definitely in the next couple slides, there is some really specific stuff about how do we ask. And I think one of the things that really popped up, and I even saw someone dropped it into the notes, is that, trying to think about how do we say it right, I think often is a really important sign of how scary and hard it is to talk about. And so, there is a level of bravery that is required. I want to encourage, if you have people in your life you're worried about, that you find safe people to practice asking the questions so that you can come to the person you love and ask very directly, are you thinking that you want to hurt yourself? Are you thinking about killing yourself? Are you, my opinion it doesn't matter what words you use for right or wrong reasons. What matters is the check-in, is the message. Like I think you were saying earlier, Joy, that it's about, I care about you, I love you, I want you to be safe, more than the exact terminology that is used. And so I think, the first piece of how to ask the questions and brave the questions is feeling like you can, and getting support to practice it and do it, so that from a place that's not from fear and reactivity, but from a place that's really direct and honest and concerned.
Do you think, Kim, that a person that's at risk, do you think they let people know what they're planning, or not so much?
I think, Joe, you're asking if I think that people let people know. No. I think that sometimes people are really in a lot of pain and they're scared of how overwhelmed they're feeling, and they will let people know. But in my experience, more often than not, it's a surprise. It's something people weren't expecting. Even professionals weren't necessarily expecting. And so, therefore, the importance of knowing more of what the signs and symptoms are, so that we can brave the questions, even if there's nothing glaringly obvious. Does that answer your question?
Yeah. Sometimes I think I agree with you that it can look either way. Sometimes what I've noticed is that people's behavior can change. They might not say it always in words, but someone that used to go to school all the time and then abruptly stops. Someone that used to be really social and then abruptly stops. Someone that's been really depressed for a long time and then becomes really like euphoric. That's what, in the person that I knew, that's what happened. They had been depressed for so long, and then for 3 or 4 days, they were just like weirdly happy and excited. And I just took it at face value.
So we're going to need to wrap up in 5 minutes. Kimberly, will you take a minute to give your final thoughts, and then we're going to wrap up here and say goodbye to you from wherever you are on the West Coast.
Blogosphere.
Yeah, thank you. And I think what you just said, Joy, is just so crucial, right? Like, what are we looking for, and how do we know that there's something we need to be concerned about? And I think some of that is all of us as family members and friends and loved ones continuing to learn how to attune and know each other more deeply. Conversation and I think it's an important one to hold in this context. I think continue on with just to raise the questions and the safety planning. It's crucial that we be willing to be brave when we're worried about people we love, and to ask not just, are you wanting to hurt yourself, but have you thought about how you would do it, and be willing to go into that dialogue to hear the things that people might be looking up online, or the scary things that they're considering doing to themselves. It's in making the space to talk about those things that we really are able to find out if the people we love need more support and help, or if it isn't, it's more a depression, or it's more just trying to manage hard feelings as opposed to a plan to really harm themselves. So I think the big thing I guess I wanted to stick in here is, don't be afraid to ask if you're concerned, because you might save a life. And it's really, it's more important to ask the question and be told, no, nothing's wrong, everything's okay, than to not ask the question and have something really sad and bad happen in our community. So I task you all with your courage to be brave with each other.
Thank you, Kimberly. We've got a final thought from Joyce before we wrap, and then one final thought from Faye before we wrap.
Enjoy.
I've got two very, very simple things to say. One is I strongly advise asking the person whether they have a plan, and that's not just for their sake, but for your sake. When you're holding this worry in your heart about someone you care about, and you've heard directly that they do not have a plan, that can put you in a place where you can be calmer about taking care of them and taking care of yourself. And I also saw a question pop in about trainings. One of the best trainings I know for people who are not in the mental health field, this is considered bystander training, is called Safe Talk. Mm-hmm. It's taught around the world, couple-hour training, very simple, clear, direct information about what to say, when to say, and what to do.
And Hope actually provides that for free.
The Hope Coalition? Mm-hmm. Provides Safe Talk.
Yeah.
Cool.
Yeah. So we have a person who does that.
Faye, any last words before we?
Oh, wow. I have to say it is so refreshing to sit around a computer and be able to talk about this topic as if it's just, and this is what we want. We want a model for all of you that just ask. Just if you see something, say something. And that's the most important thing, because it's so much better to know that you have asked than to not ask at all. And so I want to just put that message out there. And thank you all out there for listening to us, talking heads.
And I want to put out a special thanks, because what we're really doing besides this live webinar is creating an hour-long resource for you to refer back to, or anyone you know that you're concerned about to go check out. So as an audience, you all have created an incredible, rich conversation with all of these questions. And I want to thank you for that. I want to thank our experts, because you have brought a lot to this conversation, and I think we have a great resource. So before I wrap up, one more time, you can get that resource at boulderpsychologicalservices.com, or you can get that resource on our YouTube channel. There's also local resources that I believe are now showing up on the video, so you can see that as well. And we're going to clean up that intro part. So thanks for hanging in there with us, because the thing that gets shared online will have a full hour of content without all that junk at the beginning. Thanks. We wish you the best. Thanks for joining us.
Thanks, everybody.
Thanks, Kim.